Good morning, good evening, good afternoon, depending on where you are in the world. Hi, this is Kathy Fray, and welcome to another IIMHCO Maternity Natural Health webinar. As you're signing in, do please go into the chat and let us know where you are in the world and what your role is. If you're a health professional, birth practitioner, mum who's pregnant, expecting. And we're going to be welcoming here today the fabulous Lorraine Scapens. And say hi.
Hi. Hi, everybody.
What we're going to be doing today is a little bit of a format of Lorraine is going to, you got some PowerPoints I think you're going to share? Or
Just a few.
Yeah. So what's going to happen is that I'll do a little bit of an introduction as we wait for people to sign in, and then Lorraine's going to take over, and then we'll do some Q&As at the end. So if you've got any questions, please do put them into that Q&A box at the bottom of your screen. Type into there and we'll make sure they get answered. And just a reminder, as you're signing in with your chats, we'd love to hear where you are calling in from and what your role is, just so we know what the audience is today. And welcome Lorraine. Welcome Lorraine. We've just actually, because I'm speaking with people for IIMHCO from all over the world, and with these webinars, and we've just worked out, Lorraine and I, that we're geographically actually quite close, and we didn't realize. So that's kind of exciting. And Lorraine is a pre and postnatal exercise specialist with over 20 years experience, and her expert specializations are Diastasis Recti and prevention, which is going to be really good to hear about that, postpartum healing, and ensuring mothers are pain-free to enjoy living an active life with their children. Gosh, that is just, that whole postnatal exercise of the core and the pelvic floor, it just gets so forgotten, and it'll be interesting today, Lorraine, to hear from you as to what is it that are the best recommendations. I know I certainly have always mentioned it to my postnatal clients. Usually sort of around 2 weeks, I'll give them a bit of a nudgy reminder and say, have you started doing those pelvic floor exercises again? And then usually it's like, no. So it just gets gotten in the busyness. But welcome, and we're really looking forward to hearing from you.
Awesome. Great. Hi, everybody. Welcome. I'm also here in New Zealand, which is fantastic. And it's a lovely day out here. Yes, it's just going to be a great webinar. Please let us know, put any questions, as Kathy's just mentioned, in the chat box if there's anything I've not covered and that you desperately want to know. We've got a great website with lots of information on which you can refer clients to all the time. So today's session, we're going to be concentrating on that initial postpartum recovery stage and what mums can be doing to help not only be pain-free, to manage pain better if they need to. It's quite testing times for a lot of mums. This whole 4th trimester, without us realizing, can actually be more physically demanding than what mums have done previously, especially if they've been sitting down a lot in offices. And now they're going to have hold of baby constantly. They're going to be lifting buggies and pushchairs into the car. They're going to be using the pods to put them in the car. So it's actually quite a lot of weight, and it can be really physical. And yet mum's gone through an awful lot. So it's helping mums during this stage to understand also the physical demands of this trimester. Because ultimately we want mums within this first 12 months to be pain-free, to not worry about leaking when they end up running across the road with their toddlers, etc., running after them on the bikes, We don't want them to worry about the insides falling out when they're on the trampoline with the kids. We want them to be able to enjoy this period, because motherhood, as hard as it is, we all know that. I'm a mum of 3. I've got 3 girls, they've all grown up, but we know it's very demanding. And if we're in pain, whether it's back or shoulder pain, it's going to really start to test us. So what we can do is, in that initial postpartum stage, is look at exercises to help improve our recovery. And that's both physical and mental. So it's not your typical, what we think when I'm saying to encourage mums back to exercise early postnatal, it's not lunges, squats, it's not getting back to the gym, it's rehab and recovery exercises. And the main things what we need to look at are pelvic floor, core strength, diastasis recti, posture management, and how mums are holding themselves throughout the day. And I'm going to go through a couple of tips for you all to pass on to your clients. I'm just going to share a screen. I'm just going to put I don't want to go too much on the PowerPoints today. Okay, so for that initial postpartum stage, we want to look at the birth that mums have had, because this can all really affect recovery. The exercise, what we want to do, what I've just mentioned, diastasis recti, pelvic floor, and nutrition and hydration. Super important, mums look after themselves nutritionally and with the hydration, because again, that's a big energy factor and healing process. Okay, so for mums, the first thing to help with your mums is the type of birth that your clients may have had, that yourselves may have had, because then it can give mums a clearer time frame of the recovery. So what we need to look at initially is when we're looking at the type of birth. So if they've had a straightforward vaginal birth with no complications, they were fit and healthy going into pregnancy, they're probably going to recover a lot faster than somebody who's maybe need to have an episiotomy, had forceps, had a C-section, possibly even struggling to breastfeed. Okay, so that mum's recovery is going to be different to your straightforward one. Now, what are those first exercises, what we need to do for mums? So what I often say to mums is we think about the pelvic floor muscles and how they're working during pregnancy, and now how they're feeling postnatal. So for mums who have had a vaginal delivery, this is just with no episiotomy, no forceps, etc. I get them just to see, as soon as they think about it, if they can actually feel the pelvic floor muscles contracting and lifting up. Now, if someone want to do this soon after, I know for myself, being a fitness professional, I would just check mine to see if they were still switching on in the shower. So I go, oh, yep, okay, they're still working. I can still feel them lifting up. We often say to mums, you can test your pelvic floors by doing the Stop Your Pee test. This is okay, but for some women, they might be really disappointed because it's very, very hard, and your pelvic floor muscles have got to be quite functional to do this very soon after birth. We can do that a few days later, up to a week later, and we only really want to do it once as a test, because we don't want to continue with that, because that's not good for your pelvic floors either. It's too strong of a contraction. So when we're working the pelvic floor muscles, what we need to do, and this is how I get mums to do, so this is one of the first exercises mums can do after a vaginal delivery. So they want to think about contracting the pelvic floor muscles with the breath. So when we breathe in, the pelvic floor muscles are relaxed. When we exhale, we lift them up. And I say to clients, and it's good feedback, think about picking up a raisin with your fanny. Okay, so it's a pick up, not a tight squeeze. Okay, we don't want to be doing that. It's a gentle lift. And if mums can do this and practice this for those first couple of days, just doing 5 or 6 lifts. And what I like to suggest is a 2-second exhale and a 2-second inhale. 2-second exhale. You can hope you're all practicing that now. And a 2-second inhale. Now, at the moment, I don't think you can see this, but I love sitting on the balls. The balls are really, really good for feedback for mums to actually feel the pelvic floors lifting up away from the ball and dropping down. Another cue as well is for mums to imagine they're just stopping a tampon from falling out. So again, it's not that squeeze and that fist, it's a gentle lift of the pelvic floor muscles. Now, where mums might struggle with this lift and not being able to feel it from the front is for the mums who have had an episiotomy, 2nd or 3rd degree TERS, because there's a lot of tissue which needs to be healed and cellular repair which needs to be happen. And there can also be quite a lot of blood flow. All right, so that can again inhibit the brain's signals to activate the muscles correctly. So for mums who have had an episiotomy, quite a traumatic vaginal birth, they don't need to worry about their pelvic floor muscles until that swelling, until the soreness has gone. And that's what I say to mums who have had a C-section. Okay, just wait till you're not feeling sore, and then you can start your activation. So at the moment, we're still thinking about the pelvic floor. Now, a good tip is for those women who can't feel that frontal lift, which can often happen, is to do a back to front scoop lift. This is really, really good for clients and mums who have had those episiotomies, forceps, and possibly even Von-Tu's. So we know with the pelvic floor muscles, we have a bowl of muscles. So the front attach to your pelvic bone, to your pubic bone, and the back is more so near that sacrum. All right, so what we want to do is if mums are really struggling to find their pelvic floors, get them to think back to front. So what we say is stop a fart, pick up a raisin. And if mums can think of that scoop, that should start to help them get that frontal lift going. So if they can start with those basic lifts to help with their pelvic floors, in 4 to 6 weeks, there should be a massive improvement and they should be pretty much back almost to where they were on that pre-pregnancy. So again, in terms of building up, I can get mums to do 10 reps a day, okay, when they put the kettle on, maybe when they open the fridge, and then at night. It's okay to tell the mums to try and think about them when they're breastfeeding, but often when we're breastfeeding, we're sitting with our tailbones tucked under. So we're in this position, and this position again is not great for the brain to connect with the pelvic floor muscles. So it's better for mums to think of that good posture, which we will try and get to as well, to help initiate the pelvic floor muscle lift. So that is one of the first and best exercises that mums can start to do to really start to help improve their recovery. Then we jump to the second most important, and this becomes really, really important for mums, for all mums, but definitely mums who have had a C-section. So when we're training the core muscles, right, when we're trying to strengthen the core muscles, we've got to always remember what your core muscles do. We've got 4 core muscles and why it's important. Diaphragm sits at the top, pelvic floor at the bottom, our nice support with our floor, transverse wrap around the front, and multifidus wrap around the back. And it keeps a nice pressure system. All right, so 2 muscles contract while the other 2 relax. This is so important, the contract and relax, because often a lot of the problems going into birth and women having struggles to push baby out is that they can't relax and release the pelvic floor muscles because they've been too tight and they've concentrated on lifting them the whole time, and they actually can't feel the pelvic floor muscles relaxing. So postpartum, what we want to do, your pelvic floor and your transverse abdominals are best friends. All right, so we need to get those muscles contracted together for optimal core support and then relaxing, because your core muscles, one of the most important things again is to help support your posture, to heal your diastasis, to stop preventing back and pelvic pain, to prevent a hernia, but also one of the most important things which I tell mums is your core system helps to support your internal organs. All right, this is really important when we're trying to prevent and help with those mums who have suffered from certain degrees of prolapse, and especially as that goes on. So strengthening the core soon after birth is also a preventative in prolapse, because we know that many mums can be more prone to this, not initially postpartum, but the 6 to 12 months after. And that's again because they haven't done this basic core exercise. You know, even for women who are not exercise enthusiasts, all women need to strengthen and regain that core control postpartum, because what happens is when throughout our pregnancy we've got a core and it feels really strong, but what happens is baby is in there adding almost a false sense of support with our core muscles. So everything feels strong, it feels tight, it feels nice and lifted, but then when baby comes out, we're all left with these connective tissue and muscle fibers of the core system, which all need strengthening and helping to bring back together. So secondary exercise is your transverse. Now, even though they work together, pelvic floor and transverse, we need to make sure that you can contract them first by themselves. Now, this is a tricky one, okay? So I often tend to spend around about 30 minutes teaching mums to learn how to contract the transverse abdominals, because your transverse abdominals, now don't worry, you can all just get up and do this now, okay? So if you all put 2 fingers here and cough or laugh, so just cough, and you'll feel 2 little bands pop up here. They're your transverse abdominals. All right, so to activate these, and if you're not pregnant, if you've not just had a baby, it's going to be a little bit easier to feel them. So to activate these, we think about drawing the belly button in and up towards your heart. What we don't want to do is do that. Okay, it's a gentle scoop. Can you see that? That's all it is. And when mums are pregnant, I just tell them to lift up and hug the bump. And that's what gives mums the support. That's our natural muscle belt. So we don't need to wear any type of the pregnancy belts to heal diastasis, because it can switch off this natural muscle belt. I've been healing diastasis for many, many years, and I never suggest wearing the postpartum belts except for a specific one after a C-section. Okay, so we need to, so this is mum's second exercise. So we get them to activate the transverse by themselves. So it's such a subtle movement. And again, if you're watching clients, if any of you personal trainers out there and watching clients, we need to make sure that they're not over-activating the upper abdominals, because if they're doing that, if you imagine your core system like a balloon, squeezing that pressure at the top, remember what we said about this core system? If we squeeze pressure at the top, where's it going to go? It's going to go through your pelvic floor muscles or push out that diastasis recti. So we've got those couple of exercises. So we do pelvic floors by themselves, transverse by themselves, then we start to put them together. And that can be done over the first, from day 1 out to day 3. And why that's so important and why we need to do it is because mums need to be able to activate those muscles when they're lifting up baby, when they're lifting up the pods, when they're putting the pushchairs into the car. If they can't lift that, they're probably going to start to feel it in the backs. They can start to put pressure on the stitches. They can certainly put pressure on the C-section scars. So again, really, really important that we get mums to know and to think about their core muscles very, very soon after birth. A good way to think about it is, you know, if anybody was a client who came to see me as a new client, for a bicep curl, I would probably give them a 3 or 4 kg weight. So all babies are born with around about a 3 to 4 kilos. And then we're going to put them in a pod into the car seat, which is 5-ish kilos. So they're pretty much walking out of hospital with a 7 and 8 kilo weight, which is going to put a lot of stress on a weakened core system and a postnatal body, which has taken that 9 months to change. So all these, again, are factors in terms of that recovery. And again, why it's so important that we get mums, and mums can learn that the basics of activating their core muscles is really, really important postpartum. Let me know if you have any questions on that. You can pop them in the message. We're going to move on to diastasis recti. I'm going to share a screen again. So diastasis recti. Now, I've been dealing with this. All our online programs, if you know, mums can't get to see me in the studio. We're based here on the Hibiscus Coast in Auckland. I'm in Manly. I've got my own studio. So I also have online programs. And all the online programs are recommended by midwives, obstetricians, physiotherapists around the world. And it's very, very concentrated on the rehab and functional exercise. As what I said at the start, is we want mums to be fit, well, to be able to cope with the demands, both physically and mentally, of not only the first 4th trimester, but for the first 12 months postpartum, because that's what's really hard for mums. Now, diastasis recti is something that is spoken about a lot more freely at the moment. 10 or 15 years ago, when I first started looking at diastasis recti, there wasn't much information at all online. A couple of things what we need to educate clients and mums with is that it's nothing to fear. There is a lot of website and on social media there which tend to push the fear button to sell the programs. Diastasis, abdominal separation, is naturally occurring during pregnancy. At 39 weeks, 99% of all mums will have some degree of separation. It needs to happen to grow a baby. What we need to do is minimize a deep and a wide diastasis. And we can do that through the pregnancy with good exercise, good posture, good nutrition. Postpartum, the diastasis also should naturally heal, which is really cool, by around about 8 weeks. If it hasn't, mums again need to address posture, exercise, and nutrition. They're the keys for prevention for a wide diastasis in pregnancy. So we can't minimize it altogether. It's going to happen. And they're the keys to healing postpartum. So if at around 8 weeks postpartum, mum's separation is not healed, if they don't do anything about it, it's going to be the same from recent studies in 12 months' time. It may even separate a little bit further as the tissues stay soft. And if mum's still not improving her posture, maybe lifting baby too much without activating her core muscles, that separation can actually get wider. So what is abdominal separation? As you can see here from the photograph, we've got a normal abdomen. So we've all got those nice 6 packs before we're pregnant. Okay, and I want you to look at what runs down the middle, which is your linea alba. Now this is really important because we don't know the natural width. Unless you've assessed a client or you know by yourself for pregnant mums, we actually don't know what your natural width is. We know it varies from 0.5 centimeters to actually 3 centimeters. So that can be how wide a normal linea alba is. Now your linea alba structure that runs down the middle is the connective tissue which holds your abdominals together. It's that separates and stretches out to give the appearance that the abdominal muscles have separated. So they're not actually separating. It's the linea alba that's stretching out in the middle, that's starting to get wider. It's good sort of scenario to think about that linea alba, you know, blue tack. So how it starts off is that nice thick band. If you feel your own at the top, you can feel your own. Normally at the top, it should feel like a well done piece of steak. But the more it's stretched and lengthened as baby bump grows, the stringier it gets, okay? So it's getting quite deep and it starts to feel like basically a raw piece of meat. So you can start to feel those changes. And how we test for a diastasis postpartum is it's not good enough just to what we used to do is we often, you know, different people used to test. They just used to go to mums, oh, you've got a 2-finger gap. That's it. Okay, you've got a 3-finger gap. That is not enough information when we're assessing diastasis. What we need to think about when we assess a diastasis is 4 measurements. We need to get the vertical measurement, the horizontal, which is your 2 to 3. But 2 of the most important measurements are the depth. So how deep can I push my fingers when I'm assessing a diastasis? So we start at the top, and when we start to feel changes in that linea alba, that's where we start to measure the vertical diastasis from. So a lot of mums, general postpartum for a first pregnancy, would tend to have sort of a longish gap of around about 8 centimeters, not too wide, often sort of, you know, 2 to 3 fingers wide. I'm assessing mums all the time. But then how far can I push my fingers in? Can I push them into nail deep, which is a moderate? Can I go up to the 2nd finger? Can I go in really deep? The last measurement is the tension of that tissue at the deepest depth. So again, how is it feeling? Can we actually feel any tension of that tissue underneath? So the deeper it is, the less tension it is. If it feels like a blue steak as opposed to a steak that's well done, it's going to take a lot longer to recover for mums. So mums with a smaller diastasis and one that's quite shallow can generally heal their diastasis within 6 to 12 weeks of following our online programs. Quite simple, following the exercises, your breathing techniques, your core exercises, thinking about how mums are lifting, thinking about how they're using the body when they're vacuuming, picking up washing baskets, thinking about the posture. Okay, so we're going to try and get into that. I'm worried about the time as well. Okay, so postpartum, mums have generally got hold of baby all the time. Okay, and the thing what mums need to do is keep moving when settling a baby. So I say to mums, try and move all the time. So if we're rocking this way, okay, we're moving and rocking this way. So we're not in a fixed or natural position. So we're always moving. Same with our hips and legs. Change where you need to settle baby. I love to use the ball. The ball's actually really good for winding babies, which I found out with all the mums in the studio, because I'd be settling all these babies and then they'd be bringing up all their wind as well. So the balls are great. So what mums have got to be mindful of is that they're not holding baby with the sway back all the time, okay? Because that pushes that pressure out through here. They're certainly not connecting with that core strength, so this is what can prevent the healing. Also as well, mum can't really connect with her pelvic floor muscles there. So what I say to mums is we go by the ribs and hips stacked and being relaxed, okay? We can't hold ourselves in all the time. We've got good posture, but it's a relaxed posture. And that's where mums need to try and be, as opposed to this, leaning onto the hips constantly, because it's gonna start to increase back pain. Often I see the faster babies get to 5 kilos before mums 10 to 12 weeks, they're the babies that are going to start to stress and put a lot more stress onto mum and her core strength. So again, if you're working with mums, you know, baby might have even born, you know, 4.5 to almost 5 kilos, that if that baby stays on track, they're going to be quite heavy by the 10-week mark. So mum has got to be really, really on to that core strength and that initial strength and postpartum. So not only can she prevent back and pelvic pain, but also prevent a prolapse also. Moving on to that. Hi, everyone coming in. Okay, let me know if you've got any questions about diastasis recti. So just in terms of preventing a wide diastasis during pregnancy, good posture, good exercise, avoiding extra pregnancy weight gain. So we're looking at, you know, we don't want to be eating excessive sugars, excess processed foods during our pregnancy. There's a couple of things which we cannot change that can increase quite a wide diastasis. How mums, hi Kathy, couldn't to stop. Okay, so mum's torso length, okay, is a biggie. If mum's got quite a short torso and very long legs, often babies are going to push out in front, and that's going to put a lot of stress on the front of the linea alba. We can't do much of that. Some mums, as you'll see, for those of you who are midwives on, can have very, very rapid increases in weight gain when baby grows, or rapid increases in fluid. Again, this can cause stress on the linea alba. And then also at the time of pushing during pregnancy, how mums have pushed baby out can put quite a bit of stress on that linea alba. Are we all right for time, Kathy? Are we finishing up?
No, we're doing really good for time. So you've just given us so much really wonderful, specific information, which has been really good. And I've been taking some notes myself. One of the things, questions I've got, and anybody else, please throw in questions if you have any, but you've been really thorough, which is sort of, I always think when we don't see many questions, it's like it's a good sign, because we're like, the questions are getting answered. But I wonder, for those mums who can be a little bit, say a little anal or in a good way, that they want something really specific. So would you be able to maybe give us like a routine of what each day should be like to practice those three? So like do this many sets in the morning and that in the afternoon, or like how would you kind of address all of those three areas each day?
Yeah, okay, that's a great question. What I would say to mums is that obviously the first thing that they do in the morning, they're probably going to be breastfeeding straight away. When they get up to go to the toilet for the first time is often a good key. You know, once they finish on the toilet, when they're washing their hands, they can do the first 10 pelvic floor reps of the day there. That's a really good cue. And
I love that. See, that's it. Those real specific hints are so great. So yeah, that's wonderful. So first P of the day,
yeah, 10
and
pelvic floor
wash your
lifts.
hands and do your first 10
Yeah.
pelvic floors. Okay.
Yep. Then we can move through the day. I love mums to do after almost the second breastfeed of the day is to do the stretch, which is really important. So again, everything is forward for a new mum. We're changing nappies, we're lifting babies, we're breastfeeding. We're going to breastfeed like this. We need to breastfeed to look after our babies, and we need to just do it relaxed. But if we can stretch our shoulders and our neck with this stretch, say to mums, do it after the second feed of the day, it's going to help all that tension, because a lot of mums do get a lot of neck and shoulder tension for the first 2 to 4 weeks when they're starting to get used to the whole breastfeeding. So if we all do that now, if you take your right arm across, left arm underneath, push your elbows away and lift up, and you should start to feel a stretch through your neck and shoulders. So you're thinking about pushing your elbows away and lifting up, and you should feel that stretch. And if we do that,
that's a real good yoga pose.
It is. It's perfect.
Yes.
Yep. And then when mums are changing the nappies at the change table, so again, they're standing up, then they can do the transverse activations, which is really good. So what we can do for mums is we can say pelvic floor when you wash hands, transverse when you change in a nappy. So they can start to think about those muscles and start to encourage the brain to reconnect with them post-pregnancy and post-birth as well. Often mums don't realize how busy they are. So as we start to add in exercises and small floor exercises, I never say, right, you've got to do 3 exercises and 3 rounds a day, because it's often not going to happen. Just when you're down playing with baby on the floor, that's when you can start to do your first rehab exercises as well.
Oh, those are just really useful, practical guides to get to, you know, make things absolutely a bit simpler.
Yeah.
We've got one question coming in from Riel, which is a really good one. So if 6 months after birth, the mum is still having issues, what do you recommend that she is doing then?
She needs to start off at the basics. So that's, I've got mums, you know, 3-4 years later, they've missed out on these core activations. They need to go back to the very, very start. See if they can contract the pelvic floor muscles. See if they can do the transverse. Often, if we rush through or we've not been taught correctly, the back muscles are generally working too much, which obviously is going to lead to back pain. But if the upper abdominals are working too much, it can put a lot of pressure on the pelvic floor muscles as well and lead to leaking issues. So, and that's fine. We can still see changes. You can still heal a diastasis 6+ years postnatal with the right guidance. We can improve pelvic floor muscle issues as we go through. Women just need to think it's actually not normal to be feeling like you've got something in your, you know, in your vagina. If you've got it's not normal. Also as well, which I do cover with a lot of mums, is that sex shouldn't be painful also. It's going to feel a little bit different, but it shouldn't be painful. If it's
Yes,
painful,
yeah, I would always use the golden rule that if sex is still painful, I mean, it's obviously going to be painful
yeah,
when you've had a full episiotomy and things, but
yeah,
I would always say if it's still painful at 3 to 6 months, that is not normal,
yeah,
and that requires an assessment.
yeah.
Yeah.
And we've got some great pelvic floor experts up here. We're very quite lucky. I've got a list of them on the website. So we need to get mums to see those pelvic floor specialists, the women health physios, and very, very quickly, it's often just some release or scar tissue, and it's fine.
Yes, yeah, absolutely right.
Yeah,
Sometimes it's just like a little tiny tight band that's
yeah,
been created,
yeah,
and having that release just everything just feels so much better.
yeah.
Yeah. Okay, is there, just see, we've got another question coming in here. Oh, okay, somebody's just answering, they might have missed that. What is the exercise for the transverse muscle? Can you just go over that again?
Yeah, the calf activation. So we need to think about drawing, if you can see here. So we just want to see, we draw the belly button in and up. It's so minimal. You can just sort of see you want to feel the bands just activate here underneath your fingertips. And then we start to put them together with the pelvic floor muscles and do it like that. Often this is the one that the ones who have had the C-section struggle with because of the stitches here. But it's really important for those mums to do this exercise. I often get, if mums have had a C-section, to try and activate it on all fours, because that can help with much more feedback for the brain. So it's drawing
Actually, on that C-section question, how soon after a C-section are you talking about?
As soon as it's not sore. So from 7 to 10 days, you know, or even on the 14 days, they can start to activate that transverse muscle because they actually need to. So it stops the pressure on the stitches. If they can just lift up underneath when they're lifting baby, it's actually almost helping to support those stitches and just to help mum keep everything together there. Also, as well, I do teach mums a lot of scar tissue massage. So once that scar is not sore anymore, it's not red, when they're in the shower, they can start to go along the C-section, find those little lumps and start to massage them out. So that's going to help with recovery and then second pregnancies as well. So if we can reduce a lot of that scar tissue from what the
Yes, because of course they've got layers of suture in there.
Yeah.
You know, all they're seeing and is the skin at the top, but of course there's layers in there of dissolvable suture.
Yeah.
And yeah, so what they're seeing on top is just one part of that.
Yeah, and they've had to stitch through all those 7 layers. Yeah. Just also as well, the latest research for women, if you have people asking, you know, when they can go back to running exercises, I never say that mums, unless they need to have a 6 to 10 week block at whatever stage they start with core rehab, pelvic floor, glute strength, posture training before they start any running. But we know now that at 6 weeks, your fascia, your connective tissue, is only at around about 40 to 60% strength as what it was pre-pregnancy. And from the latest studies, we're not recommending any women start running until 12 weeks. So, and then they need to, if they've not done anything for 12 weeks, then they still need to do that 6 to 8 week building, core strength, and then progress from there.
Oh, that is so good to hear. I think that women, you know, they just can be way too hard on themselves.
Yeah.
In those early days, and this, you know, I need to get my body back. I need to return. I need, you know, so to have that science coming in and saying those specifics, yay, hallelujah.
Yeah. Yeah.
Yeah. So when you're saying that, so any kind of bouncing up and down type exercises, really, when you're just obviously not just running.
Yeah, we just need to be very, very mindful of it early on. Again, like I said, you know, you build up to these things slowly. We need to see it as even often when women go for a 6-week check with the doctors don't tend to check the diastasis, core strength, pelvic floor issues. Nobody at 6 weeks, not even athlete Serena Williams, is ready to go back to pre-pregnancy exercise. They're just not. When I used to teach performance a triathlete, if someone came to me after an injury, after they'd been away for a couple of weeks, we would do a really slow and gradual build. And I think mums often forget that for some reason postpartum, and they want to just jump back into it. They want to go back into their exercise classes, and yet we wouldn't do that. You know, they might have not done anything for 6 to 8 weeks, which is the reality. And yet they're still thinking that they can go back in and do a step class or an RPM class or go back into a boot camp class. We've just got to change things around and just look really deep into the recovery, enjoying the 4th trimester and making sure that mum is, like I said, pain-free, not leaking, confident in her body, confident in herself, and we take that right through, because it's too stressful as it is this time. So yeah, try not to worry about body.
And that really, so basically what yes, at the end of the day, that entire 4th trimester, which really is that sort of first 100 days or so, is just, you know, be doing those basic exercises that you're talking about, pelvis, the core, transfers, and just forget about everything else. It's official, girls.
Yeah.
You don't have to do it. Yay! Just enjoy your baby.
Yeah. Yeah.
Oh, look, you know, I just think it's such a weight that comes off, but obviously this is not well-known knowledge, not really. And do you find sometimes, well, we must wind up soon, but I've got another question. Do you find sometimes that the advice that your women are receiving from their gym instructors is conflicting with what you're saying? Like, do you kind of find, because I've certainly found that as a midwife sometimes, I'm like, your gym instructor said you to do what, you know? Do you find that conflicts a bit?
Yeah, definitely. It's hard for mums because there is a lot of conflict and they see what's happening on your Instagram. What I often say to, you know, we always said as personal trainers, listen to your body in pregnancy and postnatal. That can be key. But you can be doing certain exercises. Your pelvic floors are not going to tell you that they don't like it, but really it's not what you should be doing at this point. So they still might be able to jump on boxes, squat with 60 kgs, but they think they're listening to the body, but they're actually, and it's the same postpartum as well. You know, mums might be able to go for a run, might be able to go back, but again, we need to just look at, you know, the sleep deprivation, the breastfeeding, your body's trying to heal. So that's what a lot of, not just like your gym instructors, and it's sometimes physios, because a lot of physios don't tend to specialize in one area. So they're not used to seeing lots of postpartum and pregnancy women come in. So they don't really understand the logistics of it all, and how sleep affects everything, how breastfeeding, they're just still seeing them as pretty much as a normal client and saying, oh yeah, you'd be okay to do that. So, you know, just yeah. So it is hard.
That breastfeeding milk supply.
Yeah.
Man, you know, boy, I've seen some dramatic improvements when women have, you know, when I've realized that, oh, actually, when I'm not visiting them, they're doing a whole lot of exercise. And then we're wondering why there's, you know, a milk supply issue.
Yep.
She just needs to rest.
Yep. Walking is great, and rehab exercises, functional exercise. If any pain increases, I tell a lot of mums can say after a C-section they're getting very sore in the lower abdominal. Often they've done a little bit too much. You know, they've gone out for too big a walk, they're pushing buggy, and then they've come in and done all the housework. That things like that, too much, going back to the gym too soon can actually start to increase bleeding again. So the reducing the recovery is just trying to just be aware of everything and the different factors. I say to a lot of mums, you know, you can make goals postpartum if you want to, but they need to be flexible. We need to be able to move them around. Don't try and have, okay, I'm going to do this, I'm going to be in this shape, I'm going to do that. Try and just let it go, because there's just too many other factors that can come in in those first 12 months. And it's more the further we go. We know if when we've had 2, 3 and 4 babies, that it can be 18 months to 2 years until we get back to feeling, oh, I feel okay.
Yeah. Oh, look, I'm pregnant again.
Yeah. Yeah.
Oh, look, that's just been so good, Lorraine. And I know myself, I've made a few notes on there, that's for sure. And look, we're going to be winding things up very soon, but I just wanted a last opportunity if anybody does have any questions. And it's wonderful to see on the chats where you're coming in from. And if you haven't thrown your name up on the chat to let us know where you were from today, that's always great for us to know. And what your role is, if you're an expectant mum or a health professional. And I see we've got some people here from Europe. I know it's a horrible time of the day, so oh no, not too bad, I guess, but yeah, it's getting a bit late over there. And thank you so much, Lorraine, for your time. Is there anything else that you haven't covered that you'd like to finish off with?
I'm okay. I'm just reading a question there from Riel, and she's just asked me what the website is. My website is pregnancyexercise.co.nz, and there's about 400 blogs on there for all the different subjects that we've covered. And that's where you can get the online programs from. The Birth to Fit Mum is the postnatal program. That's our most popular. And everybody is welcome to share it as well. If you use the coupon code FITMUM, spelled M-U-M, FITMUM20, they can get $20 off the pregnancy, the postnatal programs there. So that's pregnancy exercise.
Oh, and I'm actually, you will all receive a automated email. Should be tomorrow, where it will have that information on there as well. So
great. Thanks, Kathy. It's been wonderful. Thanks for giving me the opportunity to talk to your followers as well.
Oh, it's just great. And, you know, we've been really thrilled with the fantastic feedback that we've been getting about putting these sessions on. I mean, we've got, there's almost about 6,000 on the IIMHCO database now of, you know, people wanting to know about holistic maternity integrative therapies. And, you know, we've certainly been getting some amazing speakers coming in from all over the world. So it's very nice to have a fellow Kiwi today. But what was so funny is that I didn't even know that was the situation, that we are geographically so close. But anyway, look, it's just wonderful to have you all here. Thank you very much for attending, everybody. And we wish you all a wonderful rest of your week.
Thank you, Kathy. Thanks, everybody.
Bye, everybody.
Bye.
See you.